So Dr. Andy Yun again with Allison, head of OT. A very common question we get asked is about showering in the post-operative period after joint replacement. So first of all, when can patients start showering?
Sure. So you can shower immediately after surgery. You have waterproof dressings that you'll have on in the hospital, but also be sent home with more waterproof dressings. You just make sure it's padded down on the outside. There's no holes in the dressing, or it's not lifting up off of the skin. You can go ahead and just standard showering process, nothing super mysterious, and just making sure that you're not spraying water directly onto the bandage. As soon as you get out of the shower, make sure it's padded down dry. It's pretty nice. You don't have to completely wrap it with like cellophane or something anymore.
This is a giant change in hygiene. It's not like your dad's hip replacement where he had to wait 2 to 3 weeks before a shower. You can actually shower the next day.
A lot of people opt to shower in the hospital before they leave, just to take away one of the mysterious processes of going home and feel a little bit more comfortable doing it at home if they try here first.
Okay, so Allison is going to show you the tough part about the transition to get into the shower. So we'll just follow her into the hospital bathroom.
Sure. So generally after surgery, we'll start you using a walker and then potentially advancing you to a cane and showing you getting in and out of the shower using both. So for example, using the shower, just walking into a standard standard walk-in shower, what we'll do is just have you practice the weight shift using the walker first by pressing the walker over, stepping over with the stronger leg, pretending this is my operated leg, and then bringing the walker all the way in, operated leg coming in second. Okay, so you can go into the shower, have a loved one or family member take the walker out. You can perform your showering activities here. We'll show you little techniques to get clean and washed up without losing your balance. If you're feeling a little woozy on pain meds, you're getting dizzy, lightheaded, or your balance isn't quite what it should be, we'll recommend you go home with a shower chair or a bench or something to make you a little bit more confident and safe with showering. And another thing that we recommend is that you shower with the restroom door open so steam doesn't accumulate and make you more apt to feel a little bit woozy or pass out in the shower. Always having supervision the first time you shower. So that's just a standard walk-in shower. For people who have a tub shower combination, how we recommend you stepping in and out, again, pretending this is my operated extremity, is by placing your hands on the wall or having one hand on the wall, one hand on the walker out here, stepping over with the stronger leg first, scooting over to give you a little bit more space to bring the operated leg in, and either bending it behind if you're a hip, and sometimes with a knee it's a little bit easier if you pull it in front of you like that, in case your knee flexion isn't as great, to bend it behind you like this. So that's generally how we recommend people get in and out of the shower. If you're getting out of a tub shower, if you're able to, depending on your home setup, flipping over to the other side of the tub to continuously step out with your stronger leg, which may provide you with a little bit more balance. So for people who have a tub shower combination at home and can't quite safely step in and out of the tub shower, we do have one adaptive device that may help you do so. This is an older model, but the demo one that we use is called a tub transfer bench. So what you would do with this is you'd place this over your tub, pretending that this is your really expensive tub. Okay, so 2 legs are outside, 2 legs are inside. All you would have to do is use your walker, just walk over to the tub, scoot over like this, and bring your legs on into the tub. And then it takes away that whole necessity of having to step over the threshold if you're not able to do so safely.
Which one would you recommend for patients in the first week or two?
Sure.
Should they just see if the standard walker trick works, or should they get one of these things?
It depends on how the patient's moving around. My goal is to send people home with the least restricted device so that they can return to their normal home environment using their own strength and range of motion to perform these activities. But for the most part, people will suffice with walking into a shower using a walker or a cane and the wall as some sort of comfort object to keep them a little bit more stable and balanced. But if you're not moving around quite well, you're not feeling super confident, there's no I have no qualms about sending you home with the shower chair or bench to keep you safer, because the last thing we want would be a patient fall, which can happen in the shower if you're not careful. Other things that help in a shower environment is getting a non-skid mat before surgery, having that in place. Some people will have grab bars placed, but not a necessity for the most part, but we'll go over that when we see you.
Okay, yeah, that's great. So a couple of things. So it's not like patients need to do sponge baths anymore.
No. Negative.
they can take a shower.
Yes.
What about actual bathing?
So you're not allowed to bathe until about 3 weeks.
About 2 to 3 weeks is when we tell patients.
You want to ensure adequate wound closure first, reduce your risk of infection. So no pools of water, no bathing, just showering.
Okay, great. Thank you, Allison.